Basically, I think that most people think that new research is always going to have to do with therapeutics. It'll have to do with drugs. It'll have to do with things that are hot and things that are expensive, actually. And when it comes to the way the healthcare is heading, that's great and it's important. And I think there's so much going on in terms of psoriasis, in terms of melanoma, and also in terms of management of rarer things or things where genetics are going to play more of a role. Projects talking a lot about psoriasis, not only in treatment and new medications for which new ones are coming out every day, actually. And when it comes to molecules that are being discovered and therapeutics that are novel, I feel like every few months we're finding out that something is going to change the way we practice medicine. So that's really exciting. What's different recently is that management of skin tumors, particularly invasive non-melanoma skin cancers, and treatment of melanoma has changed drastically in the past decade. And when it comes to the management of it by dermatologists and by oncologists, the research that's new and exciting is basically going to be based on individual tumors. So when it comes down to it, cancer has turned into this term that's very broad, but actually cancer, and within each individual cancer, it can be very individual, but also each signature that a patient has can change what their tumor is called and also how it's treated. In my practice, I would see between 30 and 35 patients a day, and at least half of those people are in a gown for a full skin check, and probably at least half of those have something to ask me about melanoma or something to ask me about tumors that would be dangerous or a mole that has changed. And so when you look at moles and you look at a patient, you try to decide what the risk factors are in terms of sun damage. You look at them and try to figure out what their lifestyle is like, what their exposures have been in their lifetime, and also what your best management will be of what they have. And so when we look at their skin, the number one thing is, what do we see, and what did the patient see when I wasn't with them, and what do we do about it? And so, some of the exciting research has to do with what you do with those things. We biopsy them, which dermatologists are good at, but then what happens after that? How do you make sure it's melanoma, or how do you make sure it's something else? What do you use to treat it based on that individual patient? Absolutely. I think that populations that have different climates, obviously that's going to be different. When it comes to what the local population does most commonly in State College, there's 40,000 college students. There are a lot of tanning beds. There are a lot of farmers. There are a lot of professors, and there are a lot of rural areas very nearby. And so when it comes to the most common type of patient that I see, we see a lot of college population people, but we also see tons and tons of the elderly whom during the first maybe 30 to 40 years of their lives, sunscreen wasn't even in their vocabulary. Yeah, I think that the difference between generations, of people that are in my age, my 30s, and in their 20s and their teens, is that their parents are actually dealing with the manifestations of some of that folly. So when it comes to not only lots of sun exposure, where tan and burn was sort of a norm for people that, live near the beach or go on vacation or weekend warriors and do their yard work. And when it comes to those populations of people, they're a lot better at taking care of their kids. And so even, my generation, and I have a toddler, the exposure to sun is much more about how we approach now tobacco smoke, to head into a place where it's smoky or to be worried about someone that's smoking nearby. I think that it's considered to be a carcinogen at this point. The difference is that I think education-wise, it's out there, people know. And so when it comes to using tanning beds, it's a personal choice, but I think the risks are more published, and I think it's really in the lay media as well. When it comes down to it, people are gonna do what they wanna do. And I think that individually and genetically, you could be a hermit and still get skin cancer. So it's not all about the sun, but all we can do is talk about risk factors that are preventable.